Today we have Dr. Rohan sir with.
Grandmother was a bundle of joy. The other things I always used to think was becoming a sports journalist. I'll ask Rohit Sharma and Rishabh Pant to eat less and exercise more. Not Kabir Singh for sure. Somebody asked you this question that which year did you do post-graduation? Yes, so I'm not mincing my words. The initial few years are a struggle in surgery, but it was deliberately, I was put in a different unit, right? So that I could not be with him. And, I remember each and every one of my breast cancer patients covered a lot of things about my career, which are very personal to.
Hello and welcome to Beyond the Whiteboard podcast. Today we have Dr. Rohan sir with us. We have learned from him surgery throughout our UG days to PG days. And sir, we are very glad that you are here in the podcast. And I was really waiting for you to be in this show.
Thank you very much for inviting me. And it's an absolute pleasure talking to you. I stumbled upon your Instagram handle because Dr. Deepu had liked your post and he follows you. So that's how I got to know about you, and you're doing an amazing job. So please keep it up.
Thank you so much, sir. Sir, starting since your childhood, obviously we are all proud of you as a surgeon and as a teacher, but we would love to know more about your childhood, sir. How was everything in childhood and what are most fond memories through your childhood?
So my childhood was all in Delhi. I'm born and brought up in Delhi, and my parents were doctors. So, they were establishing their practice at that time. They were in the struggling phase. So I was brought up by my grandparents, and my grandmother was a bundle of joy, used to love us a lot, make us good food, and I picked up my initial knots from her, and I always teach them in my lectures as well, the granny's knots, which I picked up from her. So childhood was all fun, playing. At our times, we weren't very serious about studies till probably 8th, 9th grade. So it was all fun, lots of cricket, lots of swimming, lots of outdoor fun. And my grandparents, like I said, my grandfather was an IPS officer, disciplinarian. So I picked up that disciplinarian attitude from him. And of course, medical things I picked up from my parents. So very early, I was clear that I wanted to take up medicine, which wasn't forced. I enjoyed it. As opposed to my brother, who always says that he was forced into medicine.
Yes.
But I enjoyed medicine, and I was very clear that I wanted to become an MBBS.
So at what point in your childhood that you decided that medicine is for you and you should prepare for PMT now?
So my brother started preparing for PMT when he was in class 11th. I was in class 8th by that time. So 7th or 8th, I was sure that I wanted to do medicine. I had great exposure. I mean, since the age of 3 or 4, I've been seeing cesareans, which my mother was doing. I was very comfortable in the OT, very comfortable seeing blood. So, that's when I decided that I want to do MBBS.
Yes, sir. Actually, sir, most of us have that weird dreams, right? Can I be a cricketer or can I be astronaut or something like that, or a film star, etc. So what was that weird dream that you think that it's now kind of weird right now?
So I always loved sports. So I wanted to do something which was related to sports and medicine. So sports medicine was one of the top things in my mind. Unfortunately, at that time, I don't think it was a very well-established branch. The other things I always used to think was becoming a sports journalist, right? Because I love following sports. So that was something which, I would like to do something regarding that in my future as well.
Definitely, sir. We'd love to see that side of news. Coming to your undergrad days, sir. So can you please tell which was your UG college and how was first year, second year, or you were studious since first year itself?
Yeah, so Saptajang happened just by chance, and I was the first batch. So we were very lucky because we were the first batch. We were taken very good care of. The teachers were excellent. They used to make extra effort to teach us. So I was always top 3 to 4 in my class, all throughout MBBS. Again, I used to study for an hour or so every day in first year. And every year, probably I used to increase 15 minutes to 30 hours. That was my daily thing. But other than that, I used to enjoy my life, roam around with friends, play cricket, enjoy my swimming as well. with the medicine, I had good exposure at home. So, I could discuss things with my parents, and that always helped because they were sharing that 20, 30-year experience with me of how to approach things. So that was an added advantage.
Yes, sir. Coming to your UJ days again, sir. At any point you thought that why I chose medicine?
So look, I've been an eternal optimist when it comes to medicine. I've heard a lot of things. In fact, I've heard my parents also later on, when running their nursing home became difficult, challenging due to the government policies and all, cripping about the branch. But I've been an eternal optimist, and every branch has its pros and cons, right? There's no ideal branch.
Yeah.
Which is there. So there are minor ups and downs, but I won't say that I ever doubted my decision of taking up medicine or surgery.
Yes, sir. So during internship, then how did you got into the postgrads as a surgeon? So how did you manage to study during that period?
So I was very clear I wanted to do surgery. This was from second year undergraduate. First clinical class was surgery, and that's when the deal was done that I wanted to take up surgery as a branch. I was preparing for USMLE, and I had cleared all my steps. I in fact had 17 calls, interview calls, because I published 3 papers. I'd done US clinical experience, presented in conferences, but then we got engaged, me and Dr. Rilla, and Dr. Rilla wanted to stay back in India, and the family said, okay, give the entrance exam, and we'll take it from there. So we both gave the exam, and I got surgery, she got pathology, and then the rest is history. We are here.
Yes, sir. So where did you do your PG and what are the fond memories in those days?
So I'm UG, PG, senior residency, all subdivision. Yeah.
Yes, sir. And if you're comfortable with that, I'd like to know your story with Ila ma'am. How did you meet?
Yeah, so I was discussing it yesterday also with a group of students. So we both were the best of friends, right from, say, towards the end of first year, beyond. And it was never dating kind of a thing. We were just very good friends. We used to discuss everything. Even after, coming back from college, probably after a few hours of studies, we used to talk on the phone, discuss what we studied. And we never thought of, getting married or thing, probably till internship. And in internship, when I was about to go for USMLE, she wanted to stay back here. I guess that's when it struck us that it would be better that we spend our lives together.
Right, story, sir.
Yeah.
Coming to after PG now, sir, many students nowadays get struggle choosing the PG branch, right? So how do you suggest them that when is the right time for them to choose that yes, medicine is for me or non-medical or surgical or medical?
So I think so. There is a reason why MBBS is 4.5 plus 1 year of internship, right? Because for some that thing can happen by first year end or second year also. But for some people, it happens probably towards the end of internship. So don't be too stressed about it, right? Enjoy your tenure and get adequate exposure. Get exposed to all the branches. When you get exposed to all the branches, that's what is going to help you choose which post-graduation do you want to pursue. Here, I would also like to say that I don't know during internship now whether you have 2 optional postings or not. At our time, we used to have 2 optional postings, right? So utilize those optional postings for departments like psychiatry if you're interested in psychiatry. Or I took up psychiatry and respiratory medicine were my 2 optionals which I had taken up. So, utilize those 2 optional postings so that you get exposed to those branches where you don't have regular clinical postings. And that can also help you choose which post-graduation you want.
Yes, and choosing surgery is really a nightmare nowadays because they obviously have to do super specialty. So what is your take on that?
Right. So we were discussing this yesterday as well, that probably I'm not the right person to be talking about this because like I said, I'm an eternal optimist. I'm all for surgery, right? So I've been criticized by students as well for glamorizing it too much. But if I had to take a call, even today, I would have taken up surgery. Yes, the time to settle down as compared to medicine is slightly more. But let me ask you one thing. When you are probably 60, 65, will somebody ask you this question that which year did you do post-graduation or which year did you become settled completely? Or would you just look back at your career and see what all you've achieved when you're 60, 65?
Obviously not. They'll not ask anything. Just look at what are you doing right now.
Correct. So that's what I'm saying. So 1 or 2 additional years in the bigger scheme of things does not make any difference. Yes, so I'm not mincing my words. The initial few years are a struggle in surgery, but in the end, it is a very gratifying branch.
Yes, sir. Now coming to some interesting questions, sir. The segment is called as imagination, in which I'll ask you some imaginary scenarios where, how would you react in these cases and what you would be doing right now. Sure. So the first question, as you mentioned, you would be a sports person or a sports physician. So supposedly now you're in the World Cup as a sports physician in New York. So how would be the situation? You're all interacting with Rohit Sharma, everybody. So how would you take that?
I'll ask Rohit Sharma and Rishabh Pant to eat less and exercise more.
So coming from Delhi again, Delhi Capitals, everything. So it's quite right advice for them, I guess. Yeah. Coming to next question, sir. Suppose you get chance to travel back in time and some invention in surgery or some great surgery is happening or surgery is originating in the world. So what point exactly you would like to witness in the past?
Well, I think so. Right now, what has revolutionized surgical branches is minimally invasive surgery, laparoscopy, robotic surgery. So probably I would want to experience how laparoscopic surgery started, the initial few days, the struggles, and how it evolved is something which would interest me.
Yes, sir. Come to one more question, sir. That's a film-based. I hope you've seen both of those. One is Gifted Hands, the other one is Kabir Singh. Everybody has seen. So how would you classify yourself?
Not Kabir Singh for sure.
Definitely, sir. Now coming to a movie character, you could have played or one character or one actor who can play your role as a biopic. So who would it be, sir?
So interesting thing. So my Twitter profile is when I didn't have this beard, and that was for my MRCS convocation. And I've got so many messages saying that pic looks like Shahid Kapoor. So I think so. The younger days, I would pick Shahid Kapoor to play my biopic if I have to.
Yeah, definitely, sir. Or you can also play, sir. Sir looks singer also, right? Yes, sir. One more question. What would be biopic named as? What is your title of your story, if you want to give?
Left-handed surgeon.
Nice. That's the Insta handle as well, right? Okay, sir. Coming to a message for the surgery residents. They are doing surgery right now. So how should they approach surgery residents?
So surgery residency, look, again, today's generation, one problem what I've experienced is that this is the generation of instant gratification, right? 100 likes or Snapchat or TikTok. So instant gratification does not work in surgery. In surgery, you have to master the art of delayed gratification. And that is what would be my advice for a surgery resident, that you need to, you've come from a time when you were preparing for MCQs and you're accustomed to doing well, and suddenly now you're the junior most in the hierarchy and you're being shouted upon, you are running around here and there, but that's a phase and you need to learn how to enjoy that phase. Because only once you go through this struggle will you enjoy your surgical career later on. So please give it some time. Don't be in a hurry to choose and then leave the branch, which I see a lot of residents doing. So be patient, do the scut work, do the basic work. You will get ample opportunities to operate in the future.
So coming to your surgery residency, sir, you must have came across some messages of toxicity, which we are seeing now also. So how would you approach that, sir?
So there are two very clear things which I want to share, that it happens with everyone. Somewhere in their career it happens. So with me, I took up surgery because of my mentor, Dr. Chintamani, and I wanted to be in his unit. But it was deliberately, I was put in a different unit, right? So that I could not be with him. But did that deter me from learning from him? No. Right? So I used to finish my ward work, then go to his ward or his OT to learn. Right. So what I'm saying is that there are certain things which are not under our control. But what is under our control is that if we want to learn, there are ways to learn. The second phase, which was really challenging for me, was when I finished both my breast surgery fellowships and I joined as an associate consultant in a corporate hospital. The atmosphere there was terrible. Terrible. I mean, that's the lowest I've felt in my medical career. And that's why I left that place within 7 to 8 months and started my own practice. And I think so that was one of the best decisions of my life.
Yes.
When I look back at it.
Yes, sir. There's one more question. It's a follow-up question. That at what time you chose for the breast surgery fellowship, sir? Or you could have done MCH as well. Why you thought that breast fellowship is for you?
So like I said, my mentor, Dr. Chintamani, he was a breast surgeon and we had this debate so many times, right? On car rides, or we both were fond of bird photography or used to go to wildlife sanctuaries. And I asked him, sir, NCH versus fellowship. And he said that if you're clear, you want to do breast surgery. And I wanted to do that. The reasons for that were that I had a couple of friends whose mother and mother's real sister, they got diagnosed with breast cancer very early in life. And they lost their battle to breast cancer. And I saw it in my family members as well. And another reason was that this was one branch where there are very few emergencies, right? And I wanted to continue teaching.
Yeah.
So this gave me that opportunity to balance out both. So when I discussed with sir, he said that even after MCH, if you have to do breast surgery only, you might as well do breast surgery straight away and just stick with it.
Yes.
At my time, there wasn't an MCH in breast. Yes, and endocrine, right? It started much later.
Yes.
So had that breast MCH been there at that time, I would have probably chosen that. But no regrets. I got trained at very good places and I'm running a very good practice now.
Yes, sir. Sir, right now, if I ask you the same question which you asked Tindamani, sir, that fellowship is better or MCH is better, what would be your answer?
Depends on the branch, right? Depends on the branch. Like just before we started, somebody asked me, I want to become a transplant surgeon. Right? So if you want to become a transplant surgeon, you have to choose which vertical. If you want to do heart transplantation, you have to do CTVS, MCH, and then a heart transplantation. If you want to do kidney transplantation, you should do urology, MCH, and then transplantation. And if it's liver transplantation, it is GI surgery, MCH, and liver transplantation. Even today, if somebody wants to do breast surgery, then I would recommend that consider doing breast MCH, breast and endocrine MCH. If you don't want to practice endocrine surgery, just do breast surgery only, then fellowship.
Yes, sir. Thank you so much. Coming to the teaching part, sir, at what point you started journey as a teacher and you got positive feedback from the students that, yes, and you also felt that, yes, I'm a good teacher and I can continue this profession.
So I don't know about good teacher or not, but I enjoyed teaching. So I was the first batch and I used to teach all junior batches, right? So when I was a surgery resident also, I used to take evening classes for the undergraduates and I used to enjoy that a lot. And I got good feedback from there. Also, I cleared my USMLE. So I had started a course, which was a very low-key course at a nursing home for clinical skills. And it was like a 3-day thing where students used to come and stay at a nursing home. And I had devised a module. We used to record all the encounters and then I used to give them feedback. So that was my initial foray into teaching. And then after that, I started teaching bigger batches. That was fun. And then when my practice started taking off, that's when Marrow happened. Me and Dr. Deepo were actually working for different startups. Yes. I was in Curofy, he was in Daily Rounds, but we used to interact with each other.
Yes.
So when I left Curofy, and that's when Dr. Deepo approached me to teach for Marrow. And I think so that was that was the second best professional decision of my life.
Yes.
To make that move.
Yes, sir. We all have grown up watching your videos itself in Marrow. Coming to the other part, after post-grad, so what were the difficulties you faced in your practice, which you think that are kind of was a lesson for you?
Right. So I started my practice when I was very young, right? And I think so that was that was a double-edged sword, right? When you're very young and you're a surgeon, initially patients don't trust you that much unless you get some white hair, right? So it was a long learning curve in that sense. But also because I was young, I was fine in waiting and watching and to see my practice grow. So I had that kind of I had time on my side. And being a male breast surgeon, a lot of people discouraged me that, females will not come to you. To the extent some of my family members also discouraged me. But now when I look back, the count which I maintain is the count of ladies who've actually said that we don't want to get examined. And that count I can still do in one hand, right?
Yes.
So not a lot of ladies. So if you counsel them well, if you make a good rapport, I don't think so that a barrier is there anymore.
Yes, sir. So would you like to share some emotional story which you came across in your patient and how you managed that case?
Look, I think so. All patients are very special. And, I remember each and every one of my breast cancer patients, especially the initial ones who trusted me very early in my career. I have a special bond with them. And, there are many stories, but one which I would like to share is one of my very early patients. Whenever she used to come for chemo, one of her friends from Noida used to come every time for her chemo. And he later on became my first financial advisor or mentor, right? So we used to sit there, we used to discuss about finances, he used to tell me how to plan finances for the future. And I think so those lessons which he gave me when I was very early in my career are helping me even to this date to have a solid financial background. And unfortunately, he lost his life in COVID. And that is something which I feel very sad about because I would love to have more conversations with him.
Yes. Coming to fun part again, sir, in which you'll have to choose one option. I'll keep on asking other options as well. So you have to choose the right option for you. Okay. So the first is, I would say, medicine versus ortho. You just have to choose one.
Medicine.
Okay. Medicine versus OBGYN.
OBGYN.
Okay. OBGYN versus PITS.
OBGYN. OBGYN was my second choice.
Yeah. OBGYN versus pathology. So now it's difficult for
OBGYN.
right. Then OBGYN versus surgery.
Surgery.
Surgery versus, I would say, CVTS.
Surgery.
Surgery versus urology.
General
Surgery. General surgery versus coming to endocrine.
endocrine surgery.
Yeah. Right. Okay, so that was the smaller one quiz, which we can keep as a reload as well in the podcast episode. Coming to the final few questions of the topic. So as you're seeing nowadays, there are lots of sites and all. Would you like to guide students for their mental health or how you used to calm yourself down in your tough phase?
Right. So, look, mental health was an issue at our time as well. It has become more of an issue now because of social media, I feel, right? Because people are always looking for instant gratification and they're looking for those likes, that dopamine hit. So if something bad happens to them, they react in an exaggerated manner as compared to probably what our generation did. Right? So I always say that please have a solid group of friends around you. And this is my advice to undergraduate students, that by the end of MBBS, you will have 8 to 10 friends of yours who are going to be your friends for life, right? Please stick to them. Please always reach out to them for help and help them out. And petty issues should not let go of those friendships. Like, you got selected, I didn't get selected this year. Or you did this, I did not do this. Those are petty issues, right? So these friends should always be there. You should have your immediate family around you and you should discuss issues with them. Don't keep them bottled up inside. That is the other thing. You have two types of people these days. Either everything comes out on social media or nothing comes out and then it comes out as an adverse reaction. So please discuss your emotions. There is professional help available, which, you can even seek that professional help as an anonymous guy. You don't need to disclose your identity. But please don't keep emotions bottled up inside and have a good set of people around you. That is what my advice to them would be.
Yes, sir. Because Instagram and all is quite total distraction, right? So would you recommend that during PG preparation, the PG phase, particularly should they use Insta or all? Obviously they can follow me.
It is it is going to be contradictory for us to say not to use it because, we are very active on it.
Yes, sir.
But I think so what is more important is what you're using it for and how much are you using it for.
Yes.
So if you can answer those two questions for yourself and if you can restrict your time on that, then it is a good or a useful tool, I would say, which can, be a good tool when you're taking a break as well. But don't get consumed by it, right? I have seen people who would probably open it up probably 1,000 times, and this you can actually check how many times you open Instagram or Facebook.
Yes.
And there are people who check it 1,000 times a day, and that is unreasonable.
Yes. Finally, sir, among last few of questions, throughout your career till now, who would you like to thank and whose efforts you are grateful for?
So, of course, my parents, grandparents, my wife who stood by me through all my professional decisions and our personal ups and downs, and my children, my mentors, especially Dr. Chintamani, who's been my surgery mentor, and my breast surgery guides, Dr. Anthony and Dr. Cynthia in America.
Yes, sir. Coming to your experience in US, sir. So how was it? Can you please elaborate in few minutes for us?
I do that. Actually, I forgot one name there, and that is Dr. Deepu. Right? He has been such a solid support for us, for both me and Dr. Illa. Even through our toughest phases, when through COVID, he made sure that we did our recording from home when Dr. Illa was expecting. Nipun, who was an IITian, and he was the first one whom I started to work on a startup with. So these are people who, given me that different aspect towards life, which probably not all doctors get exposed to.
Yes, sir. Again, lastly, for the students who are preparing for NEET PG exam, and which is again on 23rd June, so what would be your advice for them?
With 20 days left, please keep it simple and stupid. That is my principle, the KISS principle, right? Don't complicate things right now. Whatever is your revision plan, stick to it, and don't run after new resources or last minute videos which are coming up on YouTube. You've already seen them. Why are you consoling yourself, or why are you falling that FOMO trap of watching them again? Just whatever is your revision strategy, stick to it. Last one good revision is what you want.
Yes, sir. One question left actually. Students are preferring USMLE, MRCS, and MCH. These are three options available after MS surgery or after MBBS also. So how would you rank them?
If you've done MS here, USMLE, very few are going because you'll have to repeat your residency there. So if you want to do surgery there, please go there straight after MBBS. That's number one. MRCS is something, if you want to go to UK for further training, that is a good option. It is a good exam, looks good as a degree. And if you want to go to Middle East, you get paid more. So that is MRCS. MCH versus fellowships we've already discussed.
Yes, right, sir. Finally, just a final message for the audience. And we'd like you to have some motivational words from you, which inspired you also in your life.
So thank you very much for having me on this podcast. It was great talking to you. I think so I've covered a lot of things about my career, which are very personal to me, but I would want all of you to know about it. And look, motivation is always short-lived, but discipline is something which will take you longer distances. So that would be my advice. Become self-disciplined. And once you become self-disciplined, you would be your biggest motivator. That would be my advice.
Thank you so much. Thanks for watching, guys. Do subscribe to the channel and don't forget to comment your words. Dr. Rohan sir will obviously see those comments. Thank you so much.
Thank you.